Hi everyone, myself Mrs. Afroz Pathan. I am taking a video lecture on a topic called as dental products. Myself, I am working as Assistant Professor in Department of Pharmaceutical Chemistry and Analysis, School of Pharmaceutical Sciences, Vistas, Pallavaram, Chennai. So coming to the topic, first I am going to discuss about introduction on dental hygiene. Dental hygiene has been considered as an important since long time. In order to maintain dental hygiene, numerous dental products are available in the market, and many chemicals find their use in its preparation as well as in dentistry. A large number of inorganic chemicals and their preparations are known, which find application in practice of dental and oral disorders. As they come in contact with human body, they are regarded in as other drugs and pharmaceuticals. Among all vitamins, vitamin A, C, D are necessary for the proper tooth formation. Vitamin D not only helps in the absorption of calcium from GIT but also for the proper deposition of calcium and phosphorus in tooth. Other ions like magnesium, carbonate and citrate are also present in tooth like bones. A large variety of inorganic compounds are used as dental products in dental care and its treatment. Most dental products are non-prescription and also considered as over-the-counter products. A pharmacist is expected to be well versed with common dental terms, including local dental products and special terminologies so that he can advise or direct the patients accordingly. So what is the definition of dental products? Generally, dental products are the inorganic compounds and their formulations which are used in maintaining the oral and dental hygiene, and they are considered as dental products. Generally, dental products are classified into three types: anti-caries agent, polishing agent or cleansing agents, and desensitizing agents. So one by one we will discuss. First, we will see the definitions of all these three categories. First one is anti-caries agent. So these are the agents which help in prevention of tooth or dental decay. The examples include sodium fluoride, stannous fluoride, sodium monofluorophosphate. And coming to the cleaning agents, also called as polishing agents and commonly known as dentifiers. Dentifiers are the agents used along with toothbrush to clean and polish the natural teeth. They must be abrasive to some degree to remove the stains from the teeth. They are supplied in the form of paste, powder, gel, or liquid form. Examples include calcium carbonate, dibasic calcium phosphate, and sodium metaphosphate. The third category is desensitizing agent. They generally reduce the sensitivity of teeth when appears like when we have heat or cold. So the examples include strontium chloride, zinc chloride. So what do you mean by anti-caries agent? Dental caries or tooth decay, also called as dental plaque, is more or less a disease of teeth which is caused by production of acid on action of microorganisms on carbohydrates. This disease is characterized by decalcification of tooth accompanied by foul mouth odor. So, dental plaque is a biofilm or a mass of bacteria that grows on the surface of the teeth within the mouth. It is sticky, colorless deposit at first, but when it forms tartar, it is often brown or pale yellow in color. This disease is characterized by decalcification of tooth accompanied by foul mouth odor as discussed earlier. So, however, it is accepted that dental caries first of all starts on the surface of the teeth and produced by bacterial metabolism of fermenting carbohydrates which acts on teeth, it will produce lesions, whereas the bacteria gets localized in that lesions and dental caries get produced. To prevent dental caries and to maintain clean and healthy teeth, it is necessary to use dentifiers. So use of ammoniated toothpaste, urea, ammonia containing powders, antibiotics containing mixtures, and anti-enzymes compounds have been used widely, which are generally available in market as dentifiers. So what is the role of phosphate? Generally, the phosphate and calcium are used for the formation of teeth or also bones. So when this formation of this tooth decay occurs, there is a rupture of calcium and phosphate deposits on the tooth. So, if we do a coating with fluorides instead of calcium and phosphate, this tooth decay can be minimized. So, we will discuss about the role of phosphate and also role of fluorides one by one. The role of phosphate. Besides fluorides, inorganic phosphate salts have been found to be useful in reducing the dental caries. Phosphate ions are needed for stronger bones as well as healthy teeth. Coming to the role of fluoride. Administration of traces of fluoride having salts or their use in the teeth have been reported to give encouraging results in preventing dental caries. Fluoride ion is a trace material which occurs in our body. It is generally adequately obtained from food and water. In some parts of the world, groundwater is totally lacking fluoride. In such places, occurrence of dental caries has been becoming an alarming proportions. Addition of fluoride to the municipal water supply, known as fluoridation, is able to help in reducing and preventing dental caries. But this is not true because who receive slow and continued ingestion of fluoride may suffer from mottling of teeth, also called as dental fluorosis, and increases of density of bones, gastric disturbances, muscular weakness, convulsions, and even heart failure. So, continuous providing of this fluorine should be stopped due to beneficial effects in treating dental caries and in some types of osteoporosis. Fluorides find its use in dental practice and also in treatment of osteoporosis. So what will happen when a fluoride having salt or solution is taken internally? It is readily absorbed and transported and deposited in the bone or in the developing teeth, and the remainder gets excreted by the kidneys. The deposited fluoride on the surface of the teeth does not allow the action of acids or enzymes in producing the lesions. So this is the mechanism of action. So generally, when the fluoride we are not taking, because of tooth decay, means when we have food, the acid which is produced by fermenting of carbohydrates will enter into the rods of the teeth and it breaks the enamel, and later on after producing the lesions after so many days it may develop into tooth decay. Okay, so what will happen when we use this fluoride paste for fluoride solutions either internally or orally? So what we are going to do means remineralization will occur. This fluoride enters the rod into the tooth and it will treat the enamel lesions. Means it will protect our teeth for further decay, and it will fill up the gaps of calcium and phosphate deposits. Instead of that, fluoride will come and attach to the enamel. So enamel is remineralized by fluoride ions instead of calcium and phosphate. So, how we are going to take this intake of fluoride? A small quantity of 1 ppm of fluoride thus becomes necessary to prevent caries. However, if more quantity of fluoride, more than like 2 to 3 ppm is ingested, it is carried to the bones and teeth and it gives rise to molten enamel, also called as dental fluorosis. So generally in by two routes we can administer this fluoride. One is orally and another one is topically. The use of fluoridation of public water has been the most common and effective way of oral administration. Water supply containing about 0.5 to 1 ppm is provided, which is sufficient. Sodium fluoride tablets or solution of sodium fluoride in a dose of 2.2 mg per day are used. For topical application, 2% solution is generally used on the teeth. So this is the monograph regarding sodium fluoride. Sodium fluoride, the molecular formula is NaF. It is having not less than 95.8% of NaF and calculated. How it is prepared? It is prepared by neutralizing hydrofluoric acid with sodium carbonate. So 2HF, when it reacts with sodium carbonate, you will produce sodium fluoride. along with the evolution of carbon dioxide gas. Another method involves the double decomposition of calcium fluoride with sodium carbonate, where insoluble calcium carbonate can be removed by filtration. The properties of sodium fluoride includes it is colorless, odorless crystals, or it may appear as white powder. It is soluble in water, but it is insoluble in alcohol. Its aqueous solution corrode ordinary glass bottles, and hence the solution should be prepared in distilled water and stored in dark and Pyrex bottles. On acidification of salt solution, hydrofluoric acid is produced. This is a weak acid and is poisonous. Aqueous solution of salt yields alkaline reaction. So how the assay is performed for sodium fluoride? The assay is performed based upon complexometric titration method using disodium aditate. A weight quantity of sodium fluoride is dissolved in water. To it, small amount of sodium fluoride and alcohol is added. Now the contents are heated to boiling and dropwise excess of lead nitrate is added with stirring. On cooling, coagulated precipitate is filtered. Residue is washed with dilute alcohol and combined. The filtrate and the washings are now titrated with disodium EDTA using xylenol orange as indicator. So what are the uses of this sodium fluoride? A 2% solution of sodium fluoride. A 2% of sodium fluoride. Coming to the uses of sodium fluoride. A 2% solution of sodium fluoride in water is applied to children primarily for cleansing. And this is used 3 times daily at an interval of 1 week of 3, 7, 10 and 13 years of age to correspond with tooth eruption. Alternatively, a paste containing 75% of sodium fluoride and 25% of glycerol is applied to the teeth, rubbed in the form of 1 minute and removed by mouthwash. Usual dose is 2.2 mg or equivalent to 1 mg of fluoride once a daily can be used. Applications 1.5 to 3 ppm or equivalent to 0.7 to 1.3 ppm of fluoride ion is generally added in drinking water, and topically you can use not more than 2% solution of teeth. Coming to the next category, that is dentifriers are also called as cleansing agents or polishing agents. Dentifriers is a material which is used for cleaning of teeth and adjacent gums. One can apply it with finger or preferably with a toothbrush. The main drawback is that it will be able to it will not be able to clean the surfaces inside the cavities and surfaces between the teeth, even if the material reaches during the application. The cleaning action is depending upon the abrasive property and also the rubbing force used. Dentifriers are applied as powders or paste. A brushing teeth with paste has become a daily practice. Some useful substances may be included in dentifriers for providing better oral hygiene and supply of trace materials. Example like fluorides, antiseptics, deodorants, etc. They may be termed as medicated dentifriers. Flavors and colors are also usually added to dentifriers combination for improving their acceptance. A good cleansing agent must remove stain from the teeth, and to achieve this suitable abrasiveness is essential. It becomes difficult to evaluate abrasiveness. Some tests have been designed for this, but they are not comparable with when tested with in vivo conditions. The role of phosphate as anti-caries and dentifriers is well known. Calcium phosphate, dibasic, tribasic, and sodium metaphosphate are the common dentifriers used in toothpaste and toothbrushes. Similarly, calcium carbonate and pumice powder also serve as dentifriers agents. So we will discuss one of the monographs, that is calcium carbonate. On commercial scale, calcium carbonate is obtained by mixing the solutions of calcium chloride and sodium carbonate, allowing the resulting precipitate to settle down. So calcium chloride and sodium carbonate, when it reacts, it forms calcium chloride, calcium carbonate along with sodium chloride. It occurs as fine white microcrystalline powder. It is odorless and tasteless. It is stable in air. It is almost soluble in water and alcohol. Calcium carbonate neutralizes acids with effervescence. So, calcium carbonate, when reacts with HCl, clearly it is shown that calcium chloride along with evolution of carbon dioxide gas is formed. How it is identified? The reactions are characteristic for calcium ions and carbonate ions. Uses precipitated chalk, which is having a fine powdery texture, is used as identifies both powder as well as paste. It furnishes both abrasive and antacid effect in mouth. It forms a common ingredient of tooth powder and toothpaste. It is having a tendency to cause constipation and hence it is usually administered alternative and or along with magnesium salts. It is rapidly acting non-systemic antacid. It neutralizes gastric acid and forms calcium chloride. Coming to the third category called as desensitizing agents. Usually teeth are somewhat sensitive to heat or cold, especially during teeth decay or in toothache. The perception to heat and cold has been felt strongly. Therefore, some desensitizing agents are used in dental preparations so as to reduce sensitivity of teeth to heat and cold. The exact mechanism of action of desensitizing agents is not known with certainty. However, they act probably like local anesthetic. Examples of desensitizing agents include strontium chloride and zinc chloride. So coming to the monograph of strontium chloride. It is prepared by adding strontium carbonate to hydrochloric acid until the effervescence gets ceased. Effervescence due to carbon dioxide is released. The solution is filtered, concentrated, and allowed to crystalline. So strontium carbonate when reacts with HCl, it forms strontium chloride along with the formation of carbon dioxide gas. So the uses includes it acts as desensitizing agent in dental remedies. Coming to the zinc chloride. It is prepared by heating granulated zinc with hydrochloric acid. When evolution of hydrogen gases ceases, the solution is filtered and evaporated to dryness. So zinc plus 2HCl gives ZnCl2 plus hydrogen gas is evolved. Uses of zinc chloride includes it is used as an astringent, antiseptic to the skin and to the mucous membrane as a 0.5 to 2% of solution. It is used as an active ingredient to prepare magnesia cements for dental fillings and certain mouthwashes. It is also used as dentin densitizer topically as 10% solution to the teeth, and it is useful for topical use only and is administered as solution and mouthwash. So by this, I'm going to end this session. Hope this lecture will be easily understandable to first year B.Pharm students according to PCI syllabus. Thank you one and all.